My name is Giselle Vieto, and I am the Program Director for the Fremont Healthy Start Program. And I have been with EBAC since 1993. Fremont Healthy Start is a little hub where people who are new to the community come and access services, find out about resources in the community, have applications completed by people in their own language and from their same culture, and it makes them easier to access these services.
And what kind? What are these?
So these services can be anything from health insurance. Their children cannot go to school because they don't have the necessary immunizations or the required physical exams that they need to start school, kindergarten or first grade, or because they've come new to this country and they need these immunizations. So then what we'll do is we'll find the adequate coverage for them, and so staff will help them through this whole process. Applications can be very, very lengthy and very cumbersome, so it's really important for them to be able to understand all the rules and regs that come with these applications. Another area that we help them is in just basic needs, food, clothing, where to go. There are places in the community that have free clothing, and that they'll provide them one free set of clothing for each child in the household. There are places that they can go and have food every 15 days, and they'll get these food banks will provide bread and canned goods and things like that. Fremont is very ethnic and very, very, very diverse, so these food banks are now catering to this diversity in Fremont. It's not just canned corn and green beans anymore. Now you have noodles, and you have bamboo shoots in cans, where it's more likable and more acceptable for these families to go to a food bank. There are families also that, because of the economic downturn, have lost their homes or have lost their jobs, so we'll help them try to find housing. We'll try to help them refer them to the EDD department, the Employment Development Department, and we'll help them with applications if it comes down to that. So there's an array of services that we provide. Basically, it's making sure families know where to go for resources. The staff I have, it's a team. It's a wonderful family, actually. Everyone is very diverse. They're very reflective of the community as well. We speak 11 different languages, and everyone has been hired directly from the community. Everyone also has immigrated to this country from a different part of the world. So I think that's why we're so successful, because you have someone from that population's country or that person's country where they share the same experience. So we know how difficult it is I myself immigrated from Costa Rica, and I came with 5 children in tow and a husband, so I know how difficult it is. I spoke English, so it wasn't that hard, so I can just, I share that bond with these people because I know how difficult it is for you to move to a new country, not know what school your children go to, not know that health here is so expensive. It's not, many of these countries have the national healthcare system. Here, you don't, and if your child breaks an arm, it's going to cost you $1,000, $2,000, $3,000. So it's so important for them to know. And I think it's better for our community that we have healthy people growing up rather than not, or educated people growing up. We have these people that are moving into this country, a big influx from countries that are war-torn, or there's people looking for political asylum or refugees. We need to make sure that they're healthy, that they know where to go for healthcare coverage, that they know what resources are available. We need children who are educated, who know that going to school every day is the law, that they cannot break the law. So we have families that come here that maybe are coming because there's an arranged marriage, for example. So we had one case with a family. They came from India. Mom came from India, actually, and she joined her husband here, who had already been picked for her in India. So she moved here. He worked in I think he owned a cab, and he was being violent. He was abusing her, and she was with him for about 2 years before she started coming to us, and she realized that she didn't have to accept this and that she didn't have to live like this. And another thing was that he was very suspicious of everyone. He didn't want his children having health care. If he couldn't provide it, then he couldn't provide it. So we started talking to her, and we referred her to SAVE. We referred her to another community resource that spoke her language. And now she has left the husband. She's going to school. She's speaking English. She's learning to school to speak English. She's looking for work. She has placed herself in a program where her children will, it's in a program where there's a shelter. And it's, they're protecting her there. You know, it's important that people care for what we do. You know, some people might say, oh, they're new here, they'll learn, or, you know, they're on their own, or I came here and I did it, you know, my parents came here in 1960 and they did it, you know, and they have a house and they have this. Those were other times, you know, and it was very tough for them. You know, one of the things I say, my mother also came here in the 1960s, you know, and it was very difficult for her to adjust. And there's a lot of trauma associated with adjusting and for adapting to a new culture and to a new area. It's very, very traumatic for people. And with trauma, it brings isolation, it brings depression, it brings so many things to a family. So another part of it is that people should care for the things that we do, is because you want people who are healthy living next door to you. You want, if your children play with your next door neighbor and your next door neighbor comes from a different country, well, heck, why not have that children vaccinated and fully immunized and with all their physical exams to play with your child? You want people who are healthy, you want people who are educated living with you. So that's why people should care, you know? It's not a matter that we're helping those and maybe not these. No, we're helping everyone. This is a community and we should all be together in this.